But Sussan Ley, of course, has, when she took over from Peter Dutton as the Federal Health Minister, she scrapped a plan to cut rebates to doctors for short visits. And then she announced she'd go around the country consulting with doctors and their organisations. But does that mean the GP co-payment remains on the table, or is it dead, that $5 charge the government planned? That's what the Minister's consultations are about. We'll try and catch up with her a bit later on when she's had some more of her talks this morning. But one of the doctors who's been in some of these early meetings is Dr Phil Godden, who's a former chair of the local division of general practice on the Central Coast. These days calls himself just a GP. Good morning, Phil.
Good morning, Linda.
Just a GP.
That's true. Not really just a GP.
We love our GPs. The Minister says she's consulting, so how did the talks go that you were in last night?
I was actually very impressed with her. She seemed quite open. She was willing to make no commitments, as any good politician is, but she really did undertake to listen, to take note of all of the issues that we had, and I found it actually helpful that she was there, which is different to what's happened previously, but secondly, helpful that she seemed to understand the issues that we had.
What sort of issues? What's
well, the co-payment issue, for an example. She could see that there were problems with that, the problems that we had with that, the problems for some of our patients, and we kind of talked through which of the patients, but how difficult it was to be able to just across the board introduce a co-payment. And, I mean, she said really that she needed Medicare to be sustainable, which, as you've just said, is questionable, but she needed that, and so she wasn't willing to say we're not going to have it, but she was certainly willing to say it's very much up for negotiation, and unless doctors kind of widely and broadly are happy with what we decide to do, we won't do it, which was very reassuring.
Yeah, okay. Well, on that question of sustainability of Medicare, where do you stand on it?
I actually think that it's being over-talked. The proportion of spending that goes into health as a proportion of budget hasn't been increasing. I don't think that Medicare was ever designed to be funded simply by the tax payments that we have. I think it never has. The levy has never funded all of Medicare, and I don't think the proportion has changed greatly over the years. So I don't think that it's unsustainable. But at the same time, I do think the responsibility for the government to make sure that their spending on everything is efficient, and I'm sure there are savings to be had. It's just that they're really picking at health in an upside-down way.
Okay, Dr Phil Godden is with us. He's been involved in the beginning of these consultations that Sussan Ley, the Federal Health Minister, is conducting, and we'll try and catch up with her after 10 o'clock this morning. Where do you think the more efficiencies can be?
Yeah, well, there's certainly efficiencies to be had in looking at the interface between the primary sector and the hospital sector, and there's lots of duplication that happens. We in primary care feel that we are the kind of the linchpins for the future of health, and primary care is the most cost-effective way of keeping people fit and well and healthy, and yet it feels like it's primary care which has taken the brunt of all of the government's proposed cost savings. And so we think they should be looking elsewhere, really.
Hospitals?
They should be looking at the specialists. They should be looking at the multiple investigations that are done everywhere. They should be looking at the MBS, which is the medications, and they certainly should be looking at the interface between hospital and primary care and the duplication often occurs.
And so it sounds to me like what you're painting there is a picture of a potential policy for the government to pretty much pick up and plug in.
Oh, I think there's a little way further to go.
I'm sure there's details to flesh out.
That's right, yeah. Well, I think their policy needs to look further down the track. We need to be looking at what sort of health we want in our community in the next 5 years, 10 years. We need to be working out ways to keep people out of hospital. At the moment, $300 a year per person is spent at the GP, and $1,700 per year per person in Australia is spent in hospital, and it's the wrong way round. We need to have people out of hospital. We need to keep them well, and so we need policies that are going to encourage primary care, encourage people to go to the doctors, encourage people to stay well, and so end up with people not being in hospital.
And so your sense was that Sussan Ley is open to all of that?
It was, yeah. We had numbers of issues. There's issues with the way nurses are funded in general practice. There's issues with the way we are reimbursed for consumables that we use. There's issues with really the overall funding of general practice compared to other medical specialties. And she seemed quite open and quite understanding to look at all of those. In fact, her commitment was there were some things that would change in the next few weeks, and that was wonderful to hear, really.
In any sense of what that might mean?
We were talking about little specifics, like we at the moment need to ring up for authority scripts, which is just a wicked waste of time.
Yeah.
And she said, we're going to look at that. That needs fixing. And
because those are the things you could do quickly, aren't they?
Yeah. And I think my sense was that she will try and do the things quickly that she can do, that the things which are likely to be held up in the Senate, she'll work slowly through and work out ways of doing it. But as I said, I was very impressed at her willingness to just sit there and listen, and I thought that was great.
Well, it does sound like proper consultation. So what's
which is a nice change.
I hear you. What's the next? Is she going to report directly back to you? What's the feedback process going to be like?
I would expect that the feedback process here where we are will be through our local member, who's Karen McNamara, and it was Karen who kind of teed up Sussan to come here, and Karen has been really helpful as well. So I expect that the feedback will come from Sussan to Karen, and Karen will certainly talk to those GPs that she's been talking to.
Can I just ask you one thing? I'm puzzled by the differences in charging arrangements when you go to a GP. In your situation, do you routinely bulk bill everybody? Do you add on extra fees? How do you work it?
Yeah. In my practice, you're not allowed. You're allowed to add on extra fees if you don't bulk bill. But in my practice, we're a non-bulk billing practice. But the end result, we're in a low socioeconomic area, so people who see us often, people who can't afford to pay, often kids, people that that see us for a couple of things, we bulk bill, and the end result is that our practice bulk bills 71% of people.
Right.
But we're a non-bulk billing practice.
That's
in our pamphlet. We don't bulk bill, and the problem is if you bulk bill everyone, you cannot, and then see them for 15 minutes. It's not sustainable. You can't do that.
You mean you just
don't
have the
open
time?
our doors.
Right.
You don't get enough back in the Medicare rebate now because it hasn't been indexed appropriately for years. You don't get enough back to actually pay to have your doors open.
Right.
And so we can't bulk bill everyone. We do bulk bill a lot, but we are at this stage kind of moving towards bulk billing less, really, because it's becoming harder and harder.
Unless something changes too.
Yeah, unless something changes. And, we've already had a 2-year freeze on the Medicare rebates, and they're talking about another freeze for another 4 years on Medicare rebates, and that's not sustainable if you keep bulk billing. You cannot see people for an appropriate period of time.
Yeah. And Dr Phil Godden, if I can just ask you about, at a state level, Luke Foley's proposal for the nurse clinics. What's your personal response to that?
My personal response is I think it's terrible.
But they work in the ACT, Phil.
Sorry?
They worked in the ACT.
But did they work? That's the question. Did they work?
Well, I know
were they actually better than the general practices that are there? Is it the best model? Because to me, they may well work, but whether they're actually going to be... There are less nurse practitioners than there are GPs by far. So it's not a workforce, there's not an available workforce. I don't think they're any cheaper. International evidence shows that they're no cheaper to operate than general practice. And I think the best model is a model where you've got GPs and nurses working together. I have 6 nurses working in my practice. I would never work without nurses. Nurses can do things far better than I can. But we work best working together, where we actually talk together, see patients together, do it together. And I think that's the ideal model.
That was the model of Medicare locals, wasn't it? Pulling everything together?
Yeah. And that's how, it should be a team. My practice has got counsellors and got a physio and got nurses, and that's the best model. I think that's the best model. Yeah.
Well, let's see if that's what we end up with. Good to talk to you, Phil. Thank you very much.
Thank you.
Dr Phil Godden is a former chair of the local division of general practice on the Central Coast, and these days he referred to himself as just a GP. Of course, we love our GPs. 7:02